El Centro de Investigación en Salud de Manhiça representa la apuesta porque un mundo mejor es posible. Y esto entendiendo la cooperación internacional como el compartir conocimiento, compartir servicio, compartir igualdad de oportunidades, y que la ciencia y la tecnología tienen la capacidad de transformar las realidades de las sociedades, incluso o quizás especialmente de las más desfavorecidas.
20 years ago, the governments of Spain and Mozambique joined forces to build a research centre in a rural area close to the capital of Mozambique. They shared a common aim: to investigate the country's major health problems, such as malaria, diarrhoea and tuberculosis, in the most vulnerable groups in society, children and pregnant women. This was the initiative that led to the creation of the Manhiça Health Research Centre, CISM. Created as part of a bilateral cooperation programme between these two countries, CISM continued to grow and evolve until, in 2008, through the creation of the Manhiça Foundation, it became a wholly Mozambican research centre, led by the country's own researchers.
A través de esfuerzos de personas de forma muy particular, de instituciones incluso de forma muy particular, quiera de parte de España, como es la Agencia Española de Cooperación Internacional y Desarrollo, la Fundación Clínica de la Universidad de Barcelona y el Hospital Clínico de Barcelona, de parte de Mozambique, el Instituto Nacional de Sanidad de Mozambique y el Ministerio de Sanidad, han hecho que este proyecto creciera bastante. Y a lo largo del tiempo ha sido necesario que su crecimiento nos llevara a una necesidad de reestructurarlo a nivel legal.
A Fundação Manhiça começou em 2008. Foi quando foi criada formalmente a Fundação Manhiça. O papel da Fundação é promover o desenvolvimento de capacidade humana e institucional de pesquisa em matéria de saúde. E a agenda, o programa, tem que ter em conta aquilo que são as necessidades do país, de Moçambique.
Although CISM undertakes research projects all over Mozambique, most of its studies focus on the Manhiça district, an area of 2,380 square kilometres with 165,500 inhabitants. The importance of having a solid and reliable demographic database is one of the fundamental characteristics of CISM's work and the aspect that differentiates it from other African research centres. The centre's ultimate objective is to do research that will inform and influence health policies, and in this way, to improve the health of people both in Mozambique and elsewhere in Africa.
Dirigimos nuestras agendas y nuestro esfuerzo en aquellas enfermedades que realmente pueden ser, proveyendo datos, pueden ser útiles esos datos para que el ministerio o el gobierno pueda tomar decisiones basadas en la evidencia en áreas que también son importantes para ellos. Por esto nuestra agenda se preocupa 1 en malaria, 2 en tuberculosis, 3 en HIV, 4 en enfermedades diarreicas, 5 en enfermedades respiratorias.
Today, CISM has become a benchmark in the study of malaria. One of the outstanding scientific milestones in the centre's history was the clinical development of the RTS malaria vaccine. This was the first time in history that a vaccine was shown to be effective against a parasite. Malaria in pregnancy is another area in which CISM has attained an international reputation. The intermittent preventive treatment strategies used to combat malaria in pregnant women, and which were developed in the centre, are today recommended by the WHO. Diarrheal and respiratory diseases also cause many deaths among children under 5 years of age. The data CISM provides to the Ministry of Health have recently facilitated the introduction of 2 vaccines against pneumonia and the pneumococcus. In recent years, HIV/AIDS and tuberculosis have become priority areas of study for CISM. The centre has also been a pioneer in incorporating a biosafety Level 3 laboratory for the study of tuberculosis. As well as carrying out research, CISM also trains professionals and provides clinical care for patients. The training of researchers and technical staff has always been an essential component of CISM's work, and this contribution continues to play a key role in the development of Mozambique's national capacities.
Lo más importante no es solo ya para la comunidad de Manhiça, es para el país y en el fondo es para África. La generación de una masa crítica, intelectual, de investigadores, de conocimiento africana, tiene también la posibilidad de ser una fuerza transformadora para el país y para el continente entero.
The centre has also become a catalyst in the development of the local communities, contributing to the improvement in clinical care, both in terms of access and quality, in the Manhiça district. Since CISM was founded, more than 1 million outpatients have been treated in Manhiça Hospital and 6 healthcare centres in the district, and over 60,000 patients have been admitted to the hospital. Today, CISM employs more than 400 people. They all contribute to making CISM one of the leading health research centres in Africa, an achievement that has been recognised by important awards and distinctions. In 2008, the centre received the Prince of Asturias Award for International Cooperation, and in 2014, CISM received the Bagamoyo Medal for its work in training future researchers.
Mozambique era muy distinto de lo que es hoy. Hoy es un país en paz, con un crecimiento razonable, poco a poco estructurándose y demás, y esto no era la situación en el 94, 95, el país acababa de salir de una guerra muy larga, una guerra civil, que había seguido a una guerra colonial y de independencia, y por tanto el país era muy distinto.
20 years ago, Mozambique was one of the 10 poorest countries in the world, a country with enormous needs, where nothing suggested that a biomedical research centre could play an important role. Despite that, and thanks to the Spanish Development Corporation and the Mozambican institutions, today CISM has become one of the most prestigious research centres in Africa, a centre with a far-reaching impact that transcends national borders. The story of CISM is the best example of how research and science are indeed the best tools for improving health and furthering development.